I'll be talking to y'all about my cell communication disease, multiple sclerosis, and I used orange throughout my presentation because that is the national color of awareness for multiple sclerosis. So cell communication is the way that cells relay information to each other, and they do this to perform tasks. And local and long distance signaling are ways that they do this. Local signaling is when cells communicate right next to each other, and long distance is when they send hormones throughout the body. Cell junctions are little spaces in between cells that cells use to communicate. And there are 3 steps to the signal transduction pathway. There's transduction, reception, and response. And ligands are little chemicals that travel and bind to receptors to carry a signal. So to explain MS, I'll have to talk about the anatomy of a nerve cell. So these are little dendrites, and they serve as the receptors of the nerve cell. And this is the synapse, and they're the transductors. And nerve cells contain small pockets or vesicles that contain neurotransmitters. And a neurotransmitter is basically just a ligand or a chemical. And what happens is when an electric response travels down the nerve cell, it gets the neurotransmitters, and the little vesicles burst, and the neurotransmitters travel to the next cell and bind to a receptor, and then they carry the electric response with them to the next cell. Wait, I need to go back.
Do the little
Okay, so MS is an autoimmune disease that targets the central nervous system. So what happens is an unknown antigen triggers the immune cells to travel through the blood-brain barrier that's just basically surrounding your brain. And the T cells go in and they start attacking your brain and your spinal cord. So there's a protective wrapping around the nerve cells called the myelin sheath, and the T cells attack the myelin sheath and destroy it. So that stops the signal from being able to travel down the cell and reach the vesicles. So it stops the neurotransmitters from going on to the next cell. And this causes signals from your central nervous system that are sent to the rest of your body to be delayed or even stopped. And here's a picture of the signal going through. And this, you can see where it's demyelinated, and the signal goes through, and then it just kind of sputters out because it can't travel through because this is damaged. And the neurotransmitters are down here, so the signal never reaches the neurotransmitters. So the demyelination and destruction of nerve cells causes lesions to form in the central nervous system, and these are basically small tears in what's called your white matter, so basically your brain and spinal cord. And they never go away because your nervous tissue never repairs itself. And as you can see, here's a picture, and they're basically just little tears in your brain, and they cause the infamous symptoms of MS. So there are 2 forms of MS, relapsing remitting and progressive. Relapsing remitting is characterized by a short period of symptom onset where a patient goes through a really rough time, and then it's always after that there's a time of remission or the remitting period where they always get better. So it's basically a cycle of getting worse and then getting better. And the progressive MS is just basically the patient goes through just a slow decline, but it's always consistent. So it just consistently gets worse and worse in their symptoms. And 85% of patients have relapsing remitting MS. So there are many symptoms of MS because it targets the central nervous system, so symptoms can go throughout the whole body, but some symptoms consist of pain areas, tremors, muscular problems, and then whole body problems like dizziness and fatigue, urinary problems, sensory problems like pins and needles, visual problems like blurred vision or double vision, mood problems, speech problems, and then a lot of other problems are common like difficulty thinking and numbness or weakness. So scientists actually don't know the cause of MS, but they think that a combination of genetic environmental factors may be to blame. So the gene HLA-DRB1 is the most commonly linked factor to MS, so scientists think that this might correlate with the risk of MS. And then environmental factors like low vitamin D levels and ultraviolet light exposure may increase risk of contracting MS as well. And this is chromosome 6, and that's where the HLA gene variations are located. And right here is a little locus of where all of the HLA variations are located on chromosome 6. So susceptibility in clusters. Women are actually more susceptible to autoimmune diseases, and scientists think this is because of hormones, because prepubescent girls and boys are equal in their autoimmune disease like statistics, but after puberty you see more women contract autoimmune diseases. And a person with an autoimmune disease is actually susceptible to getting more than one autoimmune disease, and this is called a cluster. And scientists think this is related to genetics because they think that all the genes that cause autoimmune disorders are connected to each other. And 25% of people who have an autoimmune disease will get a cluster. So this is a cool little graphic of a cluster. So right here in the middle is the HLA-DRB1 gene that I mentioned earlier that the scientists think is related to contraction of multiple sclerosis. So if you have this gene or a variation of that gene, you potentially could contract all 5 of these various autoimmune diseases. So Dr. B. Mark Keegan at Mayo Clinic says that there are 3 steps to diagnosing someone with MS. First, you must identify cardinal symptoms like optic neuritis, which is loss of vision in one eye, double vision, weakness of the body on one side, progressive numbness from the feet up, and bowel and bladder disturbance. You must perform neurological examinations like checking reflexes and sensations and walking and balance. And then you have to perform MS-specific tests, which are like your MRIs to check for lesions. So this is an MS story. This was Evie, and she was diagnosed at age 16. She said she thought she was 16 and invincible. But, end quote, at the appointment, my GP asked me to squeeze her hand, push against her, touch the tip of her finger, and then the tip of my nose. And this is a perfect example of some of the neurological examinations that a doctor would perform in diagnosing MS. And Evie says, I can't remember what a healthy body feels like, but it's okay because I love my body and all I can still do. So there is no cure for multiple sclerosis, but treatments for symptoms are available. So to treat relapses, patients will use corticosteroids, and then to treat symptoms throughout the body, they'll use physical therapy and muscle relaxants. And you can take other medications like increasing vitamin D levels to help slow the progression. And then there's actually trials that suggest depleting the immune system and then reestablishing it will help reset your T cells to help slow the progression of multiple sclerosis. So although scientists are still researching this disease, there is a lot of hope in the MS community that they will come up with a solution and a cure, and so hopefully in the future, diagnosis of MS will be no big deal. Thank you. And there's some science memes. I took them off, but I took them off on my phone. I guess it didn't.